When a patient presents to our radiology department for a breast biopsy, we schedule them at a certain time. They present to the department and have some paperwork to fill out when they check in, and then we have them change into a gown, and they are taken to what we call a consult room. So it's just a room where the technologist and the radiologist meet with them, and we go over the procedure. We talk about the steps of the procedure, we talk about a little bit about their medical history, and then we talk about the steps of the procedure, what they can expect after the procedure, and we have them sign a consent form after they understand the risks of the procedure, the benefits, and the alternatives to the procedure. So after that is taken care of, we bring them into the ultrasound suite or the imaging suite where we're going to do the procedure. We have them typically lay on a stretcher. Their breast is exposed. The rest of their body is covered. We'd like to keep everybody as comfortable as possible. We'll give you a warm blanket. You can let us know if you're not comfortable, and we will do everything we can to make you as comfortable as possible. Usually we'll ask you to put your arm up above your head just so we can visualize the lesion in your breast a little bit better. We'll then clean off the area. We like to keep everything very clean, and we'll cover you with a drape. At that point, we will look for the lesion. We will just repeat the ultrasound and make sure we see the lesion again. And at that point, we will give a tiny bit of numbing medicine with a very tiny needle into the skin. That's the only part that can be a little bit of a discomfort. So that typically feels like a pinch and a burn. After that, we expect the patient to be completely comfortable and not to feel any pain with the procedure. And we always remind patients that if they do have any pain during the procedure, that they should let us know, because we can certainly administer more anesthetic. At that point, after everything is numb, we will do a few samples with a needle biopsy, put a little marking clip in the area so that the area is marked so we know exactly where we did the biopsy. And then we will put a few steri strips over the area after we hold some pressure. No stitches are needed, and there shouldn't be any, issues. Patients can, get up right after the procedure and have a gentle compression mammogram so that we check the placement of the marking clip that we place. We go over discharge instructions, and we make sure everybody gets a written copy. We don't expect anybody to remember anything we tell them in that moment. The instructions are very simple after the procedure. We make sure patients are easily able to leave the department very comfortably. Patients can expect to be in our department for about an hour from filling out the paperwork before to getting the discharge instructions after. I think 1 hour is a very reasonable amount of time to plan for.